Hey guys, Dr. Brown here at Brown Plastic Surgery. Welcome back to another question of the day. Today's question is, what is the most rewarding part of your job and what's the most difficult part of your job? So let's tackle the first one real quick. For me, without fail, very easy answer. For me, the most rewarding part of my job are the lives that I get to touch through doing the things that I do. I get to change people's lives in such a huge way, whether that's through breast cancer reconstruction, or maybe someone's had a very small chest their whole life and getting a small breast augmentation gives them the confidence to go back out in the world and feel good in clothing, to feel good in the relationships that they're in, to feel good in their job. You know, I think what a lot of you guys don't realize in plastic surgery, even the cosmetic stuff, it impacts people's lives in a huge way. And let me give you an example. I had a rhinoplasty when I was 24. When I looked in the mirror, all I saw was my nose, and that impacted my confidence somewhat, which meant that really impacted my relationships out in the world with other people somewhat. It wasn't something that I focused on all the time, but I looked at my nose and I saw it in the mirror, and that was what I focused on. Well, I had a rhinoplasty, and after my rhinoplasty, I didn't see my nose anymore, and that changed just the way I felt in my skin and gave me an air of confidence that I can't tell you how valuable that is. So by far, the most rewarding part of my job are the lives that I get to touch and the impact of the things that I get to do for them, which makes the other aspects of their lives better. So that's the best part. So now let's talk about the worst part. The worst part of being a plastic surgeon for me is being a perfectionist or being held to perfection. I am a perfectionist. I want everything to be perfect. I want everything to be amazing. But what I tell my patients is we're chasing perfection. There's no such thing as perfect, right? I mean, everything is somewhat asymmetric. We just weren't built that way. And also being held to the standard of perfection is something that's very difficult in my job, and having to educate patients. One of the biggest things that I do in my consultations when I'm talking to patients is I'm trying to gauge what their expectations are, okay? Is your expectation here, but what I'm seeing physically in you, we're only gonna be able to get you here? And am I able to manage you down to being happy with this, or are you always going to be holding on to this higher level? So being a perfectionist and also being held to perfection, I think, is the most difficult part of my job. And I've learned how to handle that. I think it's taken years of me being able to talk to patients and really be honest with them to let them know, hey, look, what's in your mind and what you're looking for, it isn't possible. And so unless you're willing to drop your expectations to a level that's gonna make you happy, you're never gonna be happy with anything that I do. And in those cases, I might not operate on the patient. So that's a great question, and I appreciate you asking that. Again, you guys ask the question and I'll answer it. Have a great day.